Headlines. I'm Amber Walsh, chair of the McGuireWoods Healthcare Department, and I'm joined today by two guests, Jake Cilek, partner in the McGuireWoods Healthcare Department, and John Richardson, executive director of Physician Hospitals of America. Jake and John are going to be speaking with us today on a topic that has been near and dear to my own heart for 15 years, the physician-owned hospital industry. Physician ownership in hospitals has been an element of the U.S. healthcare system for several decades, but the industry has been fighting political pressure for nearly as long as the industry has existed. Proponents staunchly believe that local physician-led healthcare helps to achieve all of the goals of the Affordable Care Act, the AAA, improving quality of care, improving population health, and reducing costs. The critics, on the other hand, have argued that physician ownership in hospital damages the healthcare system. And what many Americans don't realize is that 11 years ago, with the passage of the Affordable Care Act, those critics were actually able to halt the growth of the physician-owned hospital industry. Nevertheless, physician ownership in hospitals does continue to exist, and those hospitals continue to serve their communities and push forward. So today, we're going to hear a little bit from Jake and John about how the industry has evolved in the past decade plus since the passage of the ACA. Jake and John, I am glad to have you join us, and I'm actually going to start, Jake, with you. Can you start by just describing your practice and in particular, your work with physician-owned hospitals?
Yeah, happy to. So as Amber mentioned, I'm a partner in the McGuireWoods Healthcare Group. My practice is primarily focused on representing healthcare providers in a variety of matters, ranging from regulatory matters, compliance-related issues, all the way to, handling transactions, mergers, acquisitions, physician buy-ins and buyouts, as well as practice-related matters, and which dovetails nicely into, our firm's longstanding relationship with the physician-owned hospital industry. I've been part of kind of Amber's efforts in that regard for not the majority of the 15 years she referenced, but a large chunk of it. And specifically related to that, we help physician-owned hospitals on everything ranging from sort of day-to-day regulatory questions that are just part of the, part of what they have to deal with given some of the regulatory landscape that Amber mentioned, all the way to mergers, acquisitions, partnerships with community hospitals and other institutional providers, some of which I think I might talk about later. With you all, and it's been a great relationship. We really enjoy working with them. Physician-led organizations are always on the cutting edge, looking to do innovative things, interesting things, think about ways that they can, expand their footprint given some of the limitations they face. So it's been great, and I think, as I'll touch on later, I think there's more to come.
Thanks, Jake. And John, tell us about yourself, please, and about PHA in particular.
Yeah, sure. So I got my start in Washington, D.C. as an advisor on Capitol Hill to a member of Congress back in 1997. I spent 5 years on the Hill and then left to become a healthcare lobbyist, which I've been doing now for the past, 20 years or so. Been with PHA for about 9 of them. PHA's mission is to promote, educate, and advocate exceptional patient-centered care through physician leadership. And so we're all about putting patients first. I'm always amazed at how our hospitals relentlessly pursue innovation, high-quality healthcare models that really do save money at the end of the day. And we really believe in integrity and collaboration among the healthcare professionals that are delivering the care. And that's what we really see at physician-owned hospitals. And the proof is really in the pudding. If you look at any government published data, physician-owned hospitals really are outperforming our competitors. And that's just because of the culture of our hospitals and our physician leaders.
So, John, I know there's not an exact count, but there are roughly 250 physician-owned hospitals across the country. with a prevalence in certain geographic areas. So can you share a little bit more about the breadth of the industry, kind of where they exist, what they focus on, that sort of thing?
Yeah, sure. I think there's a myth out there that physician-owned hospitals are kind of a one type of a hospital, and it's not. The industry is quite diverse. Roughly 30% of the hospitals are what you'd consider general acute care hospitals. About 50% of the hospitals are multi-specialty, and they're primarily surgical multi-specialty hospitals. And then about 20% are single specialty. And so, we are a diverse organization industry. You'll find physician-owned hospitals all around the country, primarily in states that don't have certificate of need laws. That's not always true, but generally true. High concentrated states would be Texas, Indiana, Pennsylvania, Kansas, Louisiana, South Dakota, Oklahoma, and Ohio are where you see some of the larger concentrations of physician-owned hospitals.
So how is PHA serving those hospitals these days? Obviously, advocacy is a big part of what PHA does, but I know that there are other goals that you're focused on right now for the industry. So what can you share? Because obviously what PHA is focused on is what the industry is focused on.
Right. And so advocacy is always going to be our main focus, just because, we're being always hit by our opponents who obviously want to legislate the industry out of business. And if I could legislate my competitors out of business, I'd probably attempt to do that too. Unfortunately, Congress has gone along with them with 6001, putting a moratorium on the existing hospitals. So we do have a bill introduced. Congressman Burgess, a physician in Congress, is working with Congressman Vicente Gonzalez. They have a bill, HR 1330, currently has 22 co-sponsors that would repeal Section 6001. So that's a key element of what we're working on. But there's also other things. We've been working on a demonstration project that would allow the grandfathered physician-owned hospitals to expand while providing Medicare with some savings. So that's a program that could be innovative in terms of the model and have direct savings back to the Medicare program. We're also pursuing some direct contracting programs that would be, our industry partnering with large employers. Employers today are facing huge healthcare costs, and we think that physician-owned hospitals can be a real solution to them in providing higher quality, lower cost care. The value that we offer is really second to none in terms of the cost savings and the higher quality and the outcomes. We're also looking at to be innovative in some other areas like material management, for instance. Our member hospitals are looking for ways to streamline and reduce their overall healthcare costs. And so within the current law, we're working at smarter ways to purchase the good that allows our hospitals to operate. Jake, yourself, McGuireWoods have been very helpful in providing us with a lot of good guidance in this area.
Because realistically, we focus so much on the physician-led aspect of it, and that is how this industry is distinguished from the larger hospital industry that's not physician-led, that's investor-led or not-for-profit owned. But at its core, these businesses are hospitals first and foremost. So a lot of the same issues that are faced by community hospitals, not-for-profit hospitals are faced by physician-owned hospitals.
That's right. And so we're looking at ways that aren't directly related to the physician-owned aspect of it. And it's to your point, it's hospital operations and how do you make those more efficient? I think physicians are leaders within these hospitals, which makes, at the end of the day, it's their decision as to what they're going to purchase, how they're going to purchase it, what devices they want to use. And that really leads to higher quality because the physician that's making those types of decisions and not administrators that you'll find at other institutions that are not physician-led. And we believe that results in higher quality and better outcomes for sure.
So one of the things that I maybe should have asked at the beginning is to have maybe Jake, I will ask you to walk through just the basic restrictions. So I referenced at the beginning that 11 years ago, with the passage of the ACA, the expansion of the industry, the introduction of more physician-owned hospitals or growth of the existing ones was really stymied by Section 6001 of the ACA. Jake, why don't you just walk us through real quickly the basics of what those restrictions are and maybe some other parts of the law that really weren't troublesome at all for the POH industry that physician-owned hospitals really, frankly, embraced.
Yeah, sure. I think and John kind of alluded to this a little bit in terms of how this is structured, but I think it can kind of fall, generally speaking, into three buckets. There's what I'll call the kind of facility expansion limits. Then there's the physician ownership limits. And then there's some, what I'll kind of group together as the transparency requirements as it relates to physician ownership. And I think the first two are what we see as kind of on the forefront of everyone's mind. So when the ACA was passed, so in 2010, it essentially grandfathered all prior existing physician-owned hospitals, but locked in on a going forward basis those hospitals' ability to expand either the number of operating rooms, the number of procedure rooms, or the number of beds at the facility. There are a few limited exceptions to that. So you can expand a certain number of beds if you're a quote unquote high Medicaid facility, which has its own sort of nuanced definition, or what CMS refers to as a quote unquote applicable hospital, which also has some ties to Medicaid population, but also is linked to the specific statistical requirements related to kind of population growth in your market, as well as bed capacity in the area. Those two expansion request avenues have been utilized 7 times thus far, and all of those have been approved by CMS, which is great to see. But it is a vast minority, obviously, out of the 250 or so physician-owned hospitals out there that have been able to avail themselves of those. With respect to physician ownership, similarly, the level of physician ownership that existed as of the passage of the ACA was sort of locked in place, which is considered or referred to as the bona fide investment level, kind of a legal term of art there. So if you had 80% physician ownership, then you can't exceed that level given the restrictions that were put in the ACA. And then finally, a lot of the stuff that was built into the law related to kind of what I refer to as the transparency requirements is, from, I think, the perspective of physician-owned hospitals, totally fine, tolerable, and even sort of welcomed, because in our experience, and John can certainly speak to this, a lot of physician-owned hospitals kind of wear their status as a badge of honor. And these are things that require, disclosure of your physician ownership on your website, disclosure of physician ownership in public advertisements that reach your potential patient population, and then disclosing the physician's investment in the hospital at the time of a patient's hospital stay. So that's kind of overarching summary of the state of play there. I mean, obviously there's a ton of nuance and these things can get rather complicated, as with anything that CMS kind of puts out there and tries to get people to follow. So, but I think that's the backdrop under which POHs are operating these days. And
despite the restrictions, there are a lot of things that POHs can do to continue to evolve. So while I know PHA will always be kind of fighting to limit, get rid of, make less important and restrictive Section 6001, at the same time, POHs can evolve. So John mentioned a few things that PHA is helping physician-owned hospitals to focus on. But Jake, in terms of service line expansion, that sort of thing, what are you seeing?
Yeah, I mean, I think one thing that we're definitely still seeing is alignment with community hospitals and other institutional providers Obviously, a lot of this depends upon the grandfathered status of the physician-owned hospital involved and sort of what latitude they have there. But just to kind of mention a few examples, in February of 2020, it was announced that Medical Facilities Corporation had sold a majority interest in its South Bend, Indiana-based Unity Medical and Surgery Hospital to a group of local investors, including some leading physicians in the area affiliated with South Bend Orthopedics, the South Bend Clinic, and Allied Physicians of Michigan. So that was a notable transaction that took place that we were able to, see happen, given even in light of the restrictions. And then even kind of going a few years back, in 2017, we also saw Baylor Scott & White, which is Texas's largest not-for-profit healthcare system, enter into a partnership with Texas Spine and Joint Hospital to acquire a controlling stake in that hospital, which continue to be at least partially owned on a going forward basis. So we do see the hospitals and hospital systems on the community level, as well as sort of a statewide level, be interested in physician-owned hospitals. And then apart from hospitals, we also see ASCs and hospital management companies continue to look at opportunities to partner with physician-owned hospitals. There's a lot of natural synergies that we see in the market between ASCs and physician-owned hospitals. In fact, USPI, United Surgical Partners International, which is an ASC management company, was actually involved with the Baylor Scott & White deal as well. And, the structure of those transactions varies. I think just one little note is in kind of the post-COVID era, we see more of asset sales as opposed to stock deals, just for liability purposes. But the structure of the transactions can vary. But the point being there is that we do continue to see that. And then, the other kind of side of the coin is the physician alignment opportunities. And we do continuously see a variety of interesting ways that physician-owned hospitals build out their physician networks in the local community, through investment or otherwise. And one key way this is done is through creative managed care arrangements or CMS reimbursement initiatives, in particular, the push towards value-based care alignment with physicians, which has historically been protected for the most part under the federal anti-kickback statute, assuming the structure is appropriate. But now, with the new fraud and abuse regulations that CMS and the OIG released earlier this year, there's actually added flexibility under both the anti-kickback statute, but more importantly, under the Stark Law, or the physician self-referral law, as it relates to pursuing these types of arrangements, which really, that's a regulatory analysis that can exist outside of the investment in the hospital itself by the physicians, which relates to the ACA changes. So, it's really one of the main headlines we've taken away from those regulations that came out is pursuing what CMS and the OIG refer to as value-based enterprises. The underlying concept overall is that parties generally have more flexibility of engaging in shared risk financial models. And what this means for physician-owned hospitals is they have more opportunities to engage with outside parties or physicians in their market to achieve what CMS refers to as the value-based goals in connection with things like bundled payment models, capitated payment models, or outcome-based reimbursement. And so to just kind of wrap it up, I think there's a few examples that I could just throw out there. And obviously all these things are extremely nuanced and they require a very close analysis of the applicable regulations, what the provider looks like and what they're trying to do. But one thing that would, for example, be permitted under these rules is a value-based enterprise, which could involve a physician-owned hospital, could seek to coordinate the management of care for patients who, for example, undergo a joint replacement procedure and reduce costs while improving the quality of care. That entity could condition remuneration to physicians on referring joint replacement treatments to certain facilities under the Stark Law with certain limitations under the anti-kickback statute. And as a result, those participants could receive remuneration based upon those referrals so long as it furthers the value-based purpose, which is kind of the key there. And again, nuanced analysis, but there are opportunities that we're seeing. And similarly, just a final point, another thing we're seeing a lot of clients look at is sharing internal cost savings achieved with a physician who is a participating provider in a hospital's quality or outcome improvement program if the hospital reaches certain, pre-established benchmarks related to quality. And these programs are often referred to as gain sharing. And, all I'll say without getting too much into the weeds is we've seen the door open and add a lot of flexibility specifically under the Stark Law with these new regulations. So I know that's a lot, but I think the main takeaway is I think we still see institutional provider alignment with physician-owned hospitals. And then we see just an ever-evolving creative approach that physician-owned hospitals take to physician integration.
A lot of which community hospitals, non-physician-owned hospitals, I should say, are also doing. So the last, set opportunities that came out of the changes to the Stark Law and the anti-kickback statutes, those are opportunities for all hospital types. It is a way in which physician-owned hospitals are treated the same as other hospital types, whereas Section 6001, those limitations on expansion, the transparency rules are the ways that they are treated quite differently. So, John, let's wrap up with hearing any additional thoughts that you want to share. Would love to hear your perspective on how the physician-owned hospital industry performed throughout COVID, and anything else you want to share about the outlook for the industry or PHA, the organization.
Yeah, thanks. I mean, I think as Jake just kind of went through, there's tons of opportunity out there. Obviously 6001 is an issue. It's interesting that, a hospital can own a physician practice, but a physician can't own a hospital. And so we're going to continue to focus in on that. But there's other opportunities, as you said. Our physician owners are intertwined in their community. And so, the pandemic was a great example of how our members stepped up in times of need. And they did all sorts of things. They actually were granted a waiver from CMS to actually expand during the public health emergency. Obviously, any expansion that they undertake is limited to that public health emergency, and they'd have to basically revert back to their prior size once the emergency is over. But what you saw happen was early on, they donated PPE because a lot of them were shut down because a lot of governors said that you weren't doing elective surgery. So they donated PPE to local hospitals that were short. They then served as an overflow hospital for when you had emergent surgical issues arise. They were kind of the clean environment that didn't have the COVID patients within the walls of the hospitals. They've also provided direct COVID care. We have many of our larger members who significantly expanded, some by 40 to 80 beds to provide direct patient care that were suffering from COVID, provided additional labor resources to additional hospitals as well. And then obviously we've been centers where you can go get testing and vaccines. So, we really, as an industry, stepped up and tried to fight the virus like everyone has. And I think, at great cost for some of our members, and those will be costs that, in terms of the monetary, value, they may not get back, but because they're members of the community, it's the right thing to do, and they're more than happy to step up and do it. And so, I think that says a lot about physician owners. They care deeply about their patients, the care that they're providing, and it shows in the result, I think, and the data plays that out. So, I think that they will continue to make significant investments in their communities. They'll try to find ways where they can deliver, higher efficient, lower cost healthcare. That's what innovation's all about, and that's what really the physician leaders are all about that are running these hospitals.
Well, Jake and John, thank you so much for joining us today on Healthcare Headlines. The physician-owned hospital industry is certainly an aspect of the U.S. healthcare system that many stakeholders, including patients, are less familiar with. or if you're a patient and you're quite familiar with your physician-owned hospital in your community, many aren't aware that they are treated differently under the law in some ways. So really appreciate you coming, sharing updates on how the industry has evolved, and hope you have a great day.